Hey everyone, my name is Dr. Avanthika Chaithanya. I am a mature resident ambassador and an incoming pediatric resident. I recently took my step three prior to applying. That was in May of 2022. And I'm here to share any of the tips and tricks that I learned along the way, the resources that I used for step three, and how I managed to learn more about the CCS portion and everything about scheduling the exam to actually taking the exam and how the experience was. So if you're an IMG who is interested to take their step three prior to applying or during the application cycle, then this video is for you. So keep watching and let's begin. So first of all, the USMLE step three is not a absolute requirement. Like it's not required for you to have finished it before you apply for residency or even during your residency. A lot of IMGs still take it during the intern year, which is when it's meant to be taken. But the reason IMGs have started preferring to take it prior to the math cycle or during the math cycle and they're applying with their step three score is because it kind of gives you a few advantages. One, if you're an older graduate or if you have a lower score in one of your steps, then having done your step three, and because step three is a score exam, it kind of gives you an added advantage. It boosts your CV, and it also helps programs know that you're done with all your USMLE steps and you can focus on your intern year. And also, if you're an IMG who is eligible and who's looking for the H-1B visa, if you're a visa requiring IMG, and a lot of IMGs do prefer the H-1B visa because it does not have the waiver requirement that the J-1 visa has. So if you're aiming for a program that offers the H-1B visa, it is mandatory to be done with your step three prior to the match so that you can be eligible for the H-1B visa. And of course, being done with your USMLEs is it's a great feeling, and you don't have to worry about anything else during the intern years. So if you do have some time, I would definitely recommend you to be done with your step three exams so you can focus on your intern year once residency starts. So how are you eligible to take the step three exam? Well, you have to be done with your step one, step two. You have to be obviously have passed both your exams, and you should also be CFMG certified. Only then you will be eligible to schedule the step three exam and apply for it on the FSMB website. So the application process is pretty straightforward, except you're not really doing it on the CFMG website, but you're applying on the FSMB website. But apart from that, it's pretty quick. I think it took like maybe 2 weeks for me. There is an added step of notarizing your application, which you can either do it online or in person, like what I did here in India. But once you're done and your credentials are verified, you get your permit within 2 weeks, and you have to book a trial, which is pretty similar to the other exams, and you can schedule your exam on the Prometric. So that's pretty cool and it's pretty fast. But do remember that your step three is an exam that you can only take within the United States. So you need to make sure that if you need like visa documents or you're still waiting for your visa appointments, make sure to keep all of that in mind while picking a date for step three, because you have to travel to take the exam. And I would honestly recommend booking your date maybe like 2 months prior, because I actually did that, and towards the end I actually wanted to schedule it a bit before, and I was nipped to get dates because they do end up getting filled pretty quickly in some of the more crowded cities. So I would say maybe schedule it like 2 months before and you should be good. So the passing score for step three is 198, and I think the average score is 228 with like a standard deviation of 10 on either side. So it's pretty decent when it comes to score wise. It's not really an exam that people expect you to have 250s or 260s in. Obviously, the higher the score, the better. But in intern year, and most residents really just aim to pass their step three. But if you are aiming for a competitive fellowship, it is important that you try your best to do as well as you can in this examination. So the average time that normally people take for step three prep is 2 months, and it can go either ways. Some people take longer, some people just finish up their prep in a couple of weeks. But I would say if you are prepping solely for step three prior to applying for the match, I would say try your best to score as high as possible, because it's definitely an added advantage for your CV. And 2 months is a good time frame if you are pretty familiar with your step one and step two subjects already. So after scheduling the exam and after thinking about what resources you want, you would obviously be wondering about when do you need to take practice tests and what practice tests are there for step three. So unfortunately, there are only three NBMEs. I'm sorry, there are only two NBMEs, I think, right now available for step three. And there are two UWSA self-assessments as well. So I think I did both the UWSA assessments and then I did one NBME for practice as well as the free 120 that you find on the USMLE website. So these were all the practice tests that I took. I was actually focusing more on CCS cases and trying to get a higher score in those because I think that was something really new to me and it took me a while to understand how to work the software, how to put in my orders, how to shift the patient, and how to advance the time. So there is a clock on CCS and you can advance the time so that you can get the reports faster and you can figure out if you have the diagnosis right or wrong. So understanding the CCS software really took like the major chunk of time for me. But definitely I feel like if you are pretty familiar with UWorld and you're doing well on UWorld and you're doing well in your CCS portion, you can take a one or two practice tests just to make sure that you are in the right direction and you're confident enough to take the exam. So the NBME was pretty useful, I would say, but I think it was very similar to the UWSAs. The free 120, however, I think it was the free 135 for step three. So that was a bit tricky, but it also had a CCS component, which was obviously on the NBME website. That was also pretty good because the cases on the NBME website, along with the free 135, that was very very accurate, and some of those cases were very similar to what came on the actual exams. So I would say definitely go through your free 135 and also go through the sample cases on the NBME website.